Hi, good morning, Senator. First, I want to talk to you about Bill number 11.
Yes.
What is going on with the override attempts on Bill number 11?
So I will be moving for an override attempt in requesting to go to motions next week. And I'm hoping that, there will be a change of heart from my colleagues and seeking to get an override on this bill. In the event that it does not, garner the votes necessary, it'll be one of the first bills that I'll be introducing in the next session.
And what is the importance of getting this statute passed?
I think the importance, Troy, as you've noticed, and what's been reflected throughout is that, there really has been a significant lack of transparency and accountability, particularly when it comes to procurement. Kandit has done excellent coverage on issues with hospital contract. That currently the OPH has put out a report, a lot of question costs. When I was having the presentation of resolution to basically end the public health emergency, questions were not answered at all satisfactorily by the panel, particularly on question costs that were being discussed from Office of Homeland Security. So I really think, Troy, that whole demonstration that you saw when we were moving to end the emergency was an example of what Bill 11 would do. It would bring administration officials down on a monthly basis prior to the extension of the emergency. And the people of Guam get to see, first and foremost, all of these individuals who are managing these hundreds of millions of dollars and close to over $1 billion now just in the last 2 years. And I think, Troy, much like what you do at your operation, that kind of accountability and transparency really lends itself to making sure that government officials are much more on alert to how they spend the people's money. Procurement is something I know that is cumbersome in the government of Guam, but the bottom line is the way to get beyond that is not to whitewash transparency, work harder in terms of executing those contracts, but do not get rid of the open government law and all the transparency requirements for the people of Guam to trust their government.
Is there a general sense among senators that the public health emergency is no longer primarily about the pandemic and more so about the movement of resources?
I think so. And one thing I think is that, more and more as information comes out, like the hospital contract, like the issues surrounding the situation with the public auditor and the recent findings, I think that, it would be hard pressed for a senator to not see that probably what's going on here is more of convenience of bypassing, the legislative process, and by convenience of not adhering to the laws of Guam in terms of how they apply. That seems to be the maneuver at this point, and it's really unacceptable.